Morning, everyone. Just allow another 30 seconds or so for people to join the webinar and then we'll begin. We might make a start now. Thanks everyone for joining us today for this sector briefing with the new Social Services Regulator, Jonathan Kaplan. My name's Juanita Pope and I'm the CEO of VCOSS and really pleased to be with you today for this important sector briefing. Before we begin, I would like to acknowledge that we are on the lands of the Wurundjeri Woi-wurrung people of the Kulin Nation and pay respects to elders and ancestors. I believe that in local Wurundjeri seasons, we're heading into the season of Wurrung at the moment, which is the wombat season. Of course, Wurundjeri Woi-wurrung people have a deep respect for wombats, and during this season have observed for millennia that wombats come out and roam around to bask and graze in the warmth of the sunshine in this kind of autumn season. And also my son came back to school after school holidays just yesterday and said to me that someone in his class had gone on a holiday where they had seen lots of wombats, which is of course apt for this season, and now he would like to go next holidays to somewhere where there are lots of wombats. Just recognising and honouring the deep wisdom of the Wurundjeri Woi-wurrung and their beautiful care for our land. And I'd like to extend my respect and acknowledgement to any First Nations people joining us today and to acknowledge that we conduct our business and we work, play and live on unceded Aboriginal land. I'm opening today's session and we're really keen to hear, of course, from guest speaker Jonathan Kaplan, the new Social Services Regulator. But I did first just want to mention that I will have to do a bit of a tag team today with my colleague Libby Buckingham, who is the Director of Thriving Communities here at VCOSS, because I am attending the state funeral this morning for Les Twentyman, who sadly passed away very recently. Many of you will know the amazing work of Les Twentyman, who tirelessly advocated for social justice across 4 decades of a very eminent career, really incredible contribution to the grassroots social service movement here in Victoria. So we mourn Les's passing, we recognise his commitments and his achievements and his legacy, and I'll be obviously paying respects and passing on condolences to friends, family and colleagues at the funeral today. But you will be in excellent hands with Libby, who will take over from me shortly after Jonathan has spoken, and also facilitate the Q&A. So we are keen today to have lots of questions, and Jonathan's happy to answer your questions, which is very generous of him. So the purpose of today's briefing is to provide you with an opportunity to meet and hear from and ask questions of the new Social Services Regulator, Jonathan Kaplan, who was appointed to the role in February this year. Jonathan is an experienced public servant who has worked in various government departments, including education and justice. He was most recently the CEO of the Victorian Registration and Qualifications Authority. And Jonathan, thank you so much for taking the time to speak with the sector today. I know many organisations are very keen to hear from you, to learn more about the new social services regulations coming through this year, and to learn how they can prepare for the changes that are coming in from 1st of July. So thank you. Here's what you can expect from today's session. Shortly, I'll be handing over to Jonathan, who will provide a presentation outlining his role and the work he's been doing so far as the Social Services Regulator. And there will be plenty of time, as I say, for questions after the presentation. So please feel free to submit your questions at any time, and you can do that using the Q&A panel on this Zoom webinar. So without further ado, thank you again, Jonathan, for spending the time with us today, and over to you.
Thank you, Anita, and thank you very much for the invitation to come and talk with you and your colleagues. I too would like to acknowledge the traditional owners of the land on which we are. I'm on the land also of the Wurundjeri people of the Kulin Nation, and I'd like to pay my respect to elders past, present, and emerging, and particularly Aboriginal and Torres Strait Islander people who are joining us today. And it's a great opportunity for me to come and talk to a broad range of people. I've been very fortunate over the last few weeks. I've been out and about a lot, and I've met a number of providers and stakeholders, and it's been a really informative and terrific opportunity for me to get a good sense of the sector and sectors that sit within it. And also just to start to give people a sense of how I will approach things and what really we'll be working on together. Just before I kind of go into what we're doing and how we're doing it, just a little bit about me. After 3 years of working at the VRQA and leading that and being the Integrated Charter Sector Regulator for Education, the opportunity came up to come over to this new role. And a few things were particularly attractive and important for me. One, the interest of setting up something new, but probably the most important thing was really taking the opportunity to connect with work where I started in my career. I started as a prison drugs worker many years ago, and the working for a not-for-profit, delivering contracted services for government, and really the opportunity to come back and be part of that relationship. Because just in terms of a very short story, my first day as a prison drugs worker, I saw three things that really both confronted me but motivated me and have kept me motivated for the last 20 plus years, which were on day one, 2 out of the 4 clients I saw had suffered childhood sexual abuse. Also, a number of men in the prison self-harmed and being at the time quite confronted by the physical harm that had been inflicted upon them caused by mental health. But also, and many of you who've come from a practitioner background are very familiar with getting clients to sign consent forms. 2 out of 4 clients had to sign their names with an X. They couldn't even write their own names. And really, the opportunity to contribute to services that protect the most vulnerable Victorians was a very important opportunity for me, and one that I didn't really want to miss out on. So that ability to connect that purpose of we're all working with people and safeguarding people who, for a range of reasons, need the support and the help of social services and the government, and really the opportunity to be able to support a consistent series of services across a range of sectors is really, really exciting from my perspective. So after 3 years working with schools and apprenticeships and traineeships, I've been here for about 2.5 months. It's been a great opportunity to start focusing on a few things before the new scheme comes into effect. And a little bit about the new scheme and the new organisation. I think there's 3 very important things just to say. It is new. It's the first time that there will be an independent, and the second important thing is independent regulator, separate from the department, for a range of social services. The other thing that's very important to emphasize at the very beginning is, given that the regulator will be regulating not-for-profit, some for-profit services, and also directly delivered government services, sector neutrality is incredibly important, because one of the purposes of the scheme is that for people who are engaging with the range of services, many of which are represented here today, that they should have confidence that whether it's delivered by for-profit, for not-for-profit, or by government, that there should be a series of consistent minimum standards that are met. So part of what I'm doing at the moment is looking at standing up this new organization ready for 1 July, very conscious of those elements that I've mentioned. I'll talk a little bit now about what the scope is of the new organization and a little bit about what we'll focus on over the next 12 months. As I've been out and about, I've spoken to many people already in a range of other forums. And for those of you who already heard me, bear with me. But for others, I'll just go back to really how the next particularly 12 months will play out. And through that, I'll demonstrate, hopefully, clearly who's coming in when under the new scheme. So from 1 July, there'll be the new Social Services Regulator as an entity established. And the first series of organizations that will be registered, and they will come over through an automatic deemed registration process, are those who are already registered and regulated by the Human Services Regulator. The Human Services Regulator, as you're well aware, is part of the department. That will, through a machinery of government process, move out of the department and transition to the Social Services Regulator, where my role and myself as the public sector body head will be the employer. So really starting with that very clear separation from the department. So there'll be about 350 organizations that will be automatically transitioned across. And those will be organizations that are funded and regulated by DFFH, and also including supported residential services. There's about 350 of them. The second tranche is organizations who are not currently regulated and registered with the Human Services Regulator, but are funded by DFFH. So for many of you here, you may fall into this category. It's approximately 300 organizations where you receive the funding, but you're not registered. Having said that, the funding agreements do refer to and do pick up all the characteristics of the human services standards, which have very clear alignment, not exact, but clear and alignment with the new social services standards. And that will be a phased process starting from August and running through the year in a few stages, and I'll come to those in a moment. The third group will be organizations that are Victorian funded, but are not DFFH funded. And that really means organizations that are funded by TAC or work cover. And there's a number of those. And so in total, there should be approximately 900 organizations by the end of the transition period, registered and regulated by the Human Services Standard. One of the really important elements to note is that the department itself will be regulated from 1 July for the services it directly delivers that fall within scope. So that will include child protection, notably. So for the first time, there'll be an independent and separate regulator for department-delivered child protection and children, youth and family services. And hence the real importance of that separation and sector neutrality. So in terms of the phased implementation, family violence funded services will start to transition over from the 1st of August, homelessness from the 1st of October this year, and then from January next year, sexual assault services, and then finally from April 25 will be those TAC and work cover funded organizations. So there's a lot to do. There is some time to do it in, but really very, very important from my perspective to focus on how I can support you as providers and current or prospective duty holders to make that transition as easily and efficiently as possible. And I'm very conscious of that because of the amount of time that can be taken with regulatory and compliance related activities. And I'm conscious of that from your perspective, but I'm also conscious of it from the perspective of my organization. We will have to be really focused on where we apply our resources to best provide the protections for the vulnerable Victorians that fall within the scope of this scheme. So it's in all of our interest to really be able to identify how to do this as efficiently and effectively as possible. And I'm very appreciative of all the discussions and meetings I've had with providers that have really assisted me to understand your operating environment, but also to then cause me to think about how I can efficiently undertake what I need to do. There's a few really critical design principles for the work ahead of me. And I think that two that I want to just touch on. One is in relation to, I'm very focused on through the transition period that none of the current protections for vulnerable Victorians are diminished. And what that means is I'll take an iterative approach. It is really about evolution, not revolution. And I want to make sure that whether it's through a service provider or through the regulation that my new agency will be delivering, that we're really focused on maintaining and then building on through a continuous improvement process to strengthen those protections where we can. The other thing is on that efficiency point, I'm a really big fan of, where possible, collect once and use multiple times. So engaged in a series of discussions with the department and with other agencies, that where we can appropriately and transparently share information to reduce and make the regulatory burden and make any processes efficient, really very, very focused on that, and always very keen to hear what those opportunities are from those of you who are actually out there delivering services. The regulatory approach that we'll adopt from the beginning is a blended one. And what I mean by that is there are many new elements for some organizations. For many organizations, it will be very similar to what you're currently doing from a regulatory perspective, some reframing, some emphasis and some new language. I think it really does align heavily with the existing human services standards, but it's really incumbent upon me and my organization to make sure that we are clear and we provide you with the guidance that you need to really understand what we're asking you to do and to keep it as simple and accessible as possible. So where there are new elements and where organizations are having to do new things, absolutely, we are here to work with you. We are here to give you the support through good and clear guidance, information, education to support you. I mean, my personal view is the most powerful regulatory tool I have is one of communication, and that is information, guidance, education, and storytelling. And that storytelling of where we can demonstrate organizations clearly meeting standards through case studies and other things. And in the rare occasions where we are required to, being able to tell the story of where we've needed to and taken action to protect vulnerable Victorians. And that comes on to the second piece of the regulatory approach, that where there is significant risk of harm to service users, there will be a new series of regulatory tools that we will make use of. There are many standards and other obligations that are not changed. And one of the great examples is child safe standards. The 11 Victorian child safe standards, which align with the national ones, have been in place for over 18 months, coming up 2 years. So there's nothing per se new about those for organizations that have to have regard to them. But really, my main focus at the beginning is supporting organizations to understand what you need to do as best as we can, how to do it. But at the end of the day, we can provide information, but you'll have to make some decisions. And I'm really happy to kind of take questions on that shortly. But the important thing is to be able to have a dialogue in relation to how we can provide you with the information that you need to be able to implement any of these changes as easily as possible. As I've looked at and been out talking to organizations in relation to the new social services standards, one of my main reflections is, as I said, coming from a practitioner perspective and service manager perspective 20 plus years ago, really the elements that they describe and require are the things that have always been focused on. You know, clients at the center, safe places, safe workforces, complaints processes, what we now describe and have a better understanding around cultural safety. They're the things that have always been around. And as I've been around talking to organizations, I've been really encouraged to hear that organizations saying this is what we've been doing under the standards, but this is what we've always been doing. So how we can have the conversation about what evidence, what compliance looks like, and be clear about that, it will be really important. What compliance looks like is not prescriptive, because organizations may go about and achieve the regulatory outcomes in different ways, and that's the important thing. We've already placed guidance up on our new website that went up last week, and I really encourage you to go and start having a look at that. And what tried to do with that is highlight the new standards, highlight where there is alignment with the existing social human services standards, and give examples of what evidence might look like, and also suggest some key artifacts that I would believe that all of you as providers would have, that you have in front of you as you start to think about this. So really trying to support you to understand what the new regulatory scheme requires. We'll follow that up shortly with information about the registration process. We're just undertaking and finalising a small registration pilot. And once we've done that, we'll put guidance up. We're also developing a series of tools to assist, some readiness checklists, and further information and guidance will go up over the coming weeks. And for those of you who have questions that don't get answered today, I will be organising a webinar with questions and answer sessions similar today for the full range of organisations that may be covered by this, and really invite or encourage you to get your staff to attend that. As I've talked about, I've been out and about meeting with people. I've been taking advantage of this window where I have no operational responsibilities until 1 July, and have had the terrific opportunity to be out to Warrnambool, to Ballarat, Bendigo, Geelong, the Latrobe Valley, Mildura, off to Wangaratta and Shepparton shortly, and then all around the inner and outer Melbourne area, to really get an understanding and listen to the context that you operate in and what are your questions and concerns, as much as what you see as the opportunities and positives from this new scheme. And I really thank everybody who's found the time to meet with me. And I know that particularly when I've met with, full exec teams and a range of management within services, really appreciate the time out of busy days to do that. And it's been incredibly useful for me. Going forward, consultation engagement will be really important. And from 1 July, I will establish a peak consultative committee, which will have many of the same membership that have been on the ministerial task force that have informed the design of this regulatory scheme. But supporting that, there'll be 3 reference groups, and this will be very important. And the mix of these reference groups is important from my perspective. There'll be a reference group for First Nations people. There'll be a reference group for lived experience service users, and there'll be a reference group for providers, duty holders, because all of those perspectives will be critically important to have the real-time feedback to understand that the implementation and the effectiveness of how I go about building and operating this new organization that really is looking to deliver on something that I think we all have complete agreement on, which are safe and high quality services for vulnerable Victorians. And so that's just a little bit about who I am, what I'm doing over the next few months, what I have been doing for the last couple of months, and really kind of the approach going forward. But I'd be very keen to hear any questions, observations, and just engage in a conversation with you now.
Thank you, Jonathan. Hi, everyone. I'm Libby Buckingham, the Director of Thriving Communities here at VCOSS. I've stepped into Juanita's seat while she's stepped out to attend the funeral of Les Twentyman. Thank you, Jonathan, for that very comprehensive overview of your role and what you've been doing since you were appointed in February, and for also sharing a bit of your personal background. We do have questions coming in. If you would like to ask Jonathan a question, please type it into the Q&A part of the Zoom call, and we'll seek to answer as many, put as many questions to Jonathan as possible today. And Jonathan has kindly also referenced that if there are questions that we can't get to in our time this morning, there'll be further opportunities to follow up. Jonathan, our first question is asking for you to be able to provide further information regarding the process for registration, particularly for family violence services and homelessness services.
Sure, thank you, Libby. And as I touched on earlier, the phased implementation, we see family violence, that process starting from the 1st of August and homelessness from the 1st of October. We're just finalising the detail on what that registration process will look like. But broadly, for those in that first phase who are already registered, it will be more a case of confirming information and details to make sure that everything is current. For those who fall in that second group, which will be some family violence services and homelessness services, it's really more around completing the kind of information that you'll already have to hand relative to what you're required to provide to DFFH for under your funding agreements and that kind of contractual relationship. So I think that it should be relatively straightforward, but I'm very keen to hear any thoughts about how to keep it as simple as possible. But we'll have some more granular detail out in the next 2 to 3 weeks, I anticipate. But we're really just at the first point is about registering organizations. It's not going out and reviewing you. It's about getting the relevant information we need into our system to build the picture, and then we'll be able to come back and talk further about how over time we'll engage with you to provide that assurance and to service users.
Thanks, Jonathan. We have a question here about organisations that deliver multiple services, such as family violence, homelessness services, non-NDIS disability support. Do they need to apply multiple times for each service in line with those phased dates, or are they registered as a whole organisation from the first date applicable to them?
So we're just finalising some advice in relation to this, but in terms of how I plan to approach it, and that's something I think for you to think about as providers, is that there will be there'll be some information which is just absolutely consistent relative to whatever services you deliver, which is really about you as an entity, so your governance and other things. Then and there'll be consistent policies, I would anticipate, around complaints and other things that would sit across you as an entity. So it really then is only going down to where there is additional new services that you may need to register. And really it will be potentially a question for you whether you want to do it in a graduated way or do it in one go. From my, and I'll declare my self-interest. I'd rather be doing it once for an organization, but there will be potentially some opportunity for you to make some decisions about how to go about that. But there may be benefits in doing it once, given that it's only a portion of additional evidence about where you're delivering and what you're delivering over and above the broader stuff that you'll already have with us.
Thanks, Jonathan. The next question we have goes to, you mentioned sector neutrality. Yeah. Could you please explain this concept further and how this will work in practice?
Sure. So what's very important is that every registered organisation, every regulated organisation is held to the same standards. And so regardless of where the funding comes from, regardless of who the employer is, regardless of whether it's for profit or not for profit or government, it is incumbent upon me, and it's very, very clear, my obligation is to make sure that there is no favourable treatment, regardless of who delivers that service. So that independence and separation is very important. So all the staff will be employed by me. I am directly appointed by government and I'm accountable to the minister, not to the department or the secretary. I have a relationship with the department, but I do not work for them. And therefore, to be able to give that confidence that regardless of who's providing the service, those minimum standards will be consistent across it. So that's a cultural piece that I have to lead within the organization, but also it's something that's very important in terms of how transparently report and demonstrate that through annual reporting and other mechanisms.
Thanks, Jonathan. What enforcement carrots and sticks do you possess?
Well, regulators often have a triangle, which is, shows what you do at the pointy end, which, hopefully you don't have to do very much of, which is where you might take very clear enforcement action around applying conditions or even cancelling the registration of a service. But most of the activity happens down the bottom of that kind of pyramid. And that really is in relation to, and this is, I don't know whether you call it carrot or whether you call it actually just making it clear and simple, which is the information, education, and guidance. It's my responsibility to be really, really clear about what organizations need to do and how to do it in order to demonstrate compliance and to keep it simple to those minimum standards. It's not my role to say what best practice is. It's not my role to push organizations further than they need to go. I mean, one of the standards does require organizations to have continuous improvement processes, but it's not for me to push benchmarks higher and higher about what outputs or outcomes are. So it's really about also the risk-based approach, which is I anticipate my organization will spend 80% of its time with 20% of providers, which are those who either need help because of capacity or capability, or actually because they are knowingly and willfully not engaging or wishing to change to be consistent and compliant, which means that the vast majority, if properly supported with this is what you need to do and this is how you could do it, actually should have a lighter engagement with us. In terms of the other tools I've got, it's the storytelling where enforcement actions taken will tell that story to demonstrate there are consequences, but also we will tell the story about actually how and where we see the system responding well and delivering well. There are a few tools in between, but probably a bit more detailed for it in a conversation for another day.
Our next question is asking what the requirements for organizations are to show compliance with the new social service standards.
Sorry, just repeat that, Libby. I missed that a second, sir.
Oh, sorry, it's my my feed's just a bit jumpy. So I might actually, sorry, Jonathan, I'll jump forward to a question on a bit of a different track. We've got some questions coming through here about complaints, noting that the complaints mechanism, that the social service regulator will have a complaints mechanism. How will that work going forward?
Sure. So when government announced my appointment back in very beginning of February, it also announced that it proposes to introduce a complaints function that will sit within the regulator. That is under consideration by government, and I know that there are consultations occurring via the Social Services Task Force and others, and that's work being led by the department on the policy design and development of it. But what the intention certainly is that there is a single point where service users across any of the services that fall within the scheme can come forward to raise complaints. And within a complaints function, what's really important is a few things. One is to be really skilled and expert at being able to take the complaints, and that requires different expertise. It could be people with a disability, it could be children, it could be family members. There's a broad range. And all of that does require expertise in taking complaints. Secondly, really important is about resolution. Many complaints can be resolved without going to investigation and regulatory action. And ultimately, in the first instance, what we're really keen to be able to do is to be able to support people to understand what they can achieve through a complaint, what are the outcomes, and then being able to support them to hopefully resolve it between the provider and themselves. If that's not possible, or if the behavior or actions that are identified are of significant risk or harm, then it can move into a regulatory space. I highlight the difference because what will be important is culturally they're quite different, and so the subject to decisions by government and going through a legislative process, that the organisation will absolutely understand the different skills and activities, and we will build that in through the experience and the structure to make sure that we can effectively do both things with where appropriate communication between the two pieces. So they can exist within one organisation, but I think the point I'm making is we will recruit to the expertise and we will manage it in a way that allows good complaints outcomes as well as good regulatory outcomes where required.
Our next question is that funded organisations seem to appear on multiple department databases. It would be great if there was a single source of truth to hold organisational information. There is a risk of you creating another new database of services. Can we try to avoid this?
My answer to that is yes, I agree wholeheartedly. There's a couple of things that need to go into that. One is I think, we've already started that, and one of those design principles of collect once, use multiple times. So recently announced by the department was the SIMS review. My sense of talking to people is, people are used to using SIMS. They may not love it. It may not be the best system, but people are pretty familiar and used to it. And where any of the notification reporting requirements that the Act set out that are required and the regs, where I can collect that information from SIMS, I will do, because to report in one place is really much easier, much more efficient for the people who have to do it. Also, it stops multiple databases that then have different numbers in, where we then all spend a week of our lives trying to figure out why one thing says 25 and the other thing says 26. So that simple approach, really looking to undertake where can obviously appropriately and legally share the information, but also do it in a transparent way. And I will be very clear and will publish in relation to information sharing protocols that I establish, because I do think it's important for people to understand how their information may be used. There are a range of things that I will need to collect that are separate to the department and its role, and that do need to be confidential from them. So in terms of how we manage investigations, how we manage complaints, all of that is separate to the department. But where we can use and share and make it a simple and all-in-one system, we absolutely will do. It's in everybody's interest.
Our next question. Will the regulator have teams specific to sectors, or will staff, the regulator's staff, be expected to be Jill and Jack of all trades?
So there will absolutely need to be some specialism, expertise. And as I talked about, where it's dealing with complaints, or it might be dealing with particularly child safe standards regulation, they're just kind of some quite clear examples. It's a little bit early to really know the design of the organisation. I'm still waiting for a budget outcome from government, and that will inform how establish and set up and operate some of those things. But there will absolutely need to be expertise in the right places. Over time, one of my aspirations is staff are confident and expert to be able to work across different areas, but no, there will be distinct teams rather than just one big pool of authorised officers that one day might be in an SRS and the next day in an out-of-home care situation. So no, there will be some specialism.
Next question. Will there be transparency on service goals for the regulator that the regulator is bound to? e.g., the number of complaints received, number of investigations, percentage of successful outcomes, etc.?
Yes, over time, certainly. I think a couple of those, exemplar measures are probably more relating to a complaints function that we don't have yet and won't potentially for some time. But no, absolutely need to provide an annual report that sets out what activity we've done and to tell the story of what those outcomes have been. I think that's really important from a couple of perspectives. One is I have to absolutely account for every single dollar that government provides to the regulator. It's public money, and I shouldn't be getting any more than I need because there's need everywhere. But also being able to tell the story of what we've done, of where action has needed to be taken, is a regulatory tool in itself. So absolutely, we'll be as transparent as well. We'll be transparent, and we'll be able to both report on activity as well as regulatory outcomes.
Thanks, Jonathan. The next question, can you please provide any more specifics about the timeline for when other guidance resources, e.g. a readiness toolkit, will be released? It would be great to know what some of these resources will be in advance as well.
So we've got the 6 info sheets on the standards up now. There's 2 more information sheets on the standards that should come out in the next 10 days or so. And they're settled. They just need to be put into a accessible format and then published. There's guidance on the registration to be published in early May, including forms and checklists later in May. And also one of the things that has come back through the consultation we've done is simple things like a really clear glossary. So where we refer to an outcome or an output or whatever, we're just really clear about what that means for us, because it can mean different things for different organizations and different schemes. So a series of things like that will come out. We'll do more online sessions later in May. And really it's a case of just finalizing that pilot program and then being able to produce the information. So May, you'll start to see a significant amount more engagement, both in terms of publications, but also webinars and other things.
Thank you, Jonathan. How will registered organisations demonstrate compliance with the new regulatory standards? And will registered providers be published or listed on the website of the regulator?
So we are required to have a register. But in terms of what compliance looks like, really giving, and you can have a look in those info sheets already produced, and this is high level because it's not subsector specific, what evidence and compliance might look like. But as I said before, it's not about being absolutely prescriptive, because organizations might achieve outcomes in different ways. And there are some kind of basic things that you'd expect everybody to have, risk registers, delegations, kind of some of those formal documents. But there's a lot of other things that organizations might call different things, might be able to describe, and we will engage with you to understand, and we will develop what that evidence and compliance looks like over time. But I think there's some good pointers at what it looks like. I might preempt one of the questions that may come up, but also one that has come up pretty much with everybody I've met as I've been out and about, which is around what were the previous compliance audits, the independent review body audits. They're not required by the regulator. It's up to organizations how they want to go about assuring themselves and being ready, if required, to be able to demonstrate compliance. So some organizations have said, we're going to keep doing it because we find it useful and it's beneficial and it's a reasonable investment for us. Others have said we have other quality assurance processes that give us confidence that we are compliant and are able to demonstrate that. And others are having a think about it. So, there is a choice for organizations about how they are, and really matter for your governance and your boards about how you're confident that you are well placed to be able to be compliant. And relative to that, there will be some other, within that, there'll be your own processes. to develop what would be your kind of portfolio of evidence if required or requested. And for some organizations, it may actually be quite a while in between engagement with us. It may be based on notifications where we need to make some inquiries, or it may be other issues that come up. Another point just to make is some organizations will make a lot of notifications, and that's not because it's a bad organization. It's because it's a particularly complex client group that you're dealing with. So I just want to be clear that just because you're putting lots of things into SIMs that are coming to us, the presumption is not that it's an organization in trouble. It's an organization that may just have a very complex client group. And we will ask, simple questions to establish that in the first instances. So really want to have that proportional engagement, that not everything, causes a regulatory response that is bigger or unnecessary than required from my perspective.
How will the legislative reforms build in an assurance that lived experience of disability and disability expertise is a feature?
Well, there's two bits to answer that question. One is actually the legislative reforms that are being considered by government. I'm a stakeholder to that. I'm as interested as anybody in that, and I think it's critically important to get it right. So I can't comment on that. What I can comment on, regardless of whether it's enshrined explicitly in legislation or not, absolutely must ensure, and this is a personal commitment, that the expertise and experience to be able to undertake the work, whether it's through complaints or through other regulatory activity that's required, that we have the absolute expertise, both in terms of the staff, but the input via consultative mechanisms to make sure that we are well placed to be able to do that. And as I said, my absolute starting point is no diminishing of existing protections, and therefore only hopefully over time being able to enhance. But critical will be that expertise, both in terms of input, and also staff. So that's my commitment to it. But in terms of what the legislation looks like, that's really a matter for the department to support government over.
We have a few questions coming through about organisations' individual position vis-a-vis you as the regulator.
Yeah.
Is there a capacity for individual organisations to have a one-on-one consultation to fully understand their status, transition and compliance requirements, particularly if there is a lack of clarity about whether they are in or out of scope for the scheme?
Yeah. So look, they're always anticipated there may be some organizations which are unsure. I think for most organizations, it's pretty clear. But if there is any uncertainty, on the new website is a new inquiries inbox. I suggest if you can put a note into there, and then somebody will be in contact and we will work that through. And over time, we'll be able to develop more guidance that hopefully unpacks those questions in a way that you can just go to our website, read for 2 or 3 minutes and have those questions answered. But until we can get to that point, absolutely just send in the queries and we'll work that through. And if we need to have an individual conversation, we'll absolutely do that.
Thanks, Jonathan. Final question. We've got a few questions about further consultation and engagement. Yep. Are you able just to outline going forward your plans for engagement with the sector?
So, as I said, from commencement of the scheme, we'll establish this kind of primary consultative committee. And that will be really important, and that will have, all representatives that represent the sectors that fall within the broader sector, but then the 3 reference groups, and that will be very important. And as I said, First Nations, service user, lived experience, and duty holder. But separate to that, the engagement that I'm doing now, the engagement that I'll continue doing and my staff will be doing, will be a really important opportunity as we go about our work to hear from you. We're building the plane while flying it. And certainly from 1 July, we're going to be airborne, but still lots to do. Some uncertainties and unknowns. And so I really see over the next 2 years a critical importance of a dialogue. And that dialogue is us being able to support and inform you, but also, really keen to have the feedback. One of the things is about, from my perspective, right-sized regulation. And what I mean by that is we're minimum standards. So it's great to see organizations going over and above what's required, but we have to remind ourselves of where that kind of line is. Having said that, over time, things can creep, either from directions and other things or individuals. And so I really want to make sure that there is a ongoing and healthy and constructive conversation around making sure it's right size. And that's right size in order to minimize the burden, but it's also right size to make sure that the resources I've got are used in the most effective way to protect those really vulnerable Victorians. And one of the things I've been able to do as I've kind of gone around over the last few weeks is go out, particularly to a number of supported residential services, and go in there and talk to residents and to look at services and to really be reminded, and it's not just a one-off thing that I'll be doing, that this is what it's about. It's about supporting and protecting those really vulnerable and disadvantaged Victorians, and getting that right and making sure that our reach and our impact obviously is within scope and of powers and things, but that it's really as broad and as effective as possible. So I've got to get every benefit out of the scheme for those people, just as you need to get every benefit out of every dollar that you receive from government. So we're in the same, I think we've got the same goals. And so that conversation about how we collectively achieve that is going to be really important through the formal and the informal mechanisms.
Thank you, Jonathan. I think that's an appropriate point to wrap up today's Q&A session. Thank you for your time and for answering so many questions. For everyone that has followed along today, if you have further questions or queries, please feel free to contact the team here at VCOSS. We are regularly posting updates onto the VCOSS website, so feel free to jump on to the website for further information. And Jonathan, at the very beginning of his presentation, kindly assured us that there'll be more opportunities to ask questions and learn more about the new scheme and his role as regulator. Jonathan, do you want to say a few words before we close off this morning to finish?
Thank you. And look, first of all, to thank VCOSS for the opportunity to do this. To say thank you to everybody who's hosted me, whether it's in their services or whether they've met me in town or wherever that is, and to say that, really keen to come out and meet more of you and to visit more services, because I think it's really important to understand the context that we operate in. I'm also aware that regulatory reform is not the only change and challenge that organizations are dealing with. So it's not happening in isolation. So that context is really important. Also, from you, I can hear around where there may be opportunities to collect information you provide to other bodies that we can use in a way that makes it efficient. So really pleased to come and talk to organizations further. Really keen to hear from you. And though I've spent a lot of time recently out and about, it's something that will be a kind of a regular feature rather than a kind of honeymoon period of trips around place. So I'm just really excited to establish a relationship and to build on that as we just collectively work towards, great services for the vulnerable Victorians that need them.
Thank you, Jonathan.
Thank you, Libby.